Hello, everybody. Dr. Alex Vasquez coming to you live this afternoon to talk about maybe about 20 articles that I just downloaded this morning after seeing someone mention last night on social media what's something called COVID vaccine-induced psychosis. So, again, I just saw this kind of casually last night, actually late last night, and then I looked it up also late last night, and then I downloaded all the articles I could find this morning, and I'm going to take a look at those articles right now. It's about 20 or 22 articles that I downloaded, and so although I kind of planned to talk about other things today, I think that this is important because 80%. Imagine this: 80% in some places, 80% of some populations have been injected with the COVID vaccine. And if we are now accumulating a reasonable base of evidence to show that these COVID vaccines actually cause mental illness, then that's something that we could reasonably want to be aware of. Even if you didn't get the vaccine, or maybe if you did, I think we would all benefit from being aware of this topic because, again, it's something that apparently affects, in some cases, 80% of some populations in some countries. A lot of people were forced to get the vaccine, against their desires because they wanted to travel, or they had to see somebody in the hospital, or they had to get medical care. For example, when we were I've mentioned this several times already, so I'm not trying to be redundant, but for some people, this is the first time they've been exposed to this information. We were in Spain during the initial 2 years of the COVID pandemic. And for example, one of our best friends who lived in the city next to us, she was a cancer patient, and her doctors refused to treat her unless she got the COVID vaccine. So, that sucks for her, but that is what happened. My mom, when we were still in Spain, my mom had cancer for the last 2 years that we were there. She got cancer in 2021. After she had been vaccinated twice. She developed breast cancer in early 2021, and she had, I think, chemo and radiation and surgery for that breast cancer. And then at the middle of 2021, immediately after she finished treatment for breast cancer, she got pancreatic cancer right after that. That's very unusual to get two new cancers within the same 6 months. And in her case, like I said, it was right after she had gotten vaccinated 2 and then ultimately 3 times for COVID. But again, as I started to say a moment ago, a lot of people didn't have the option, so it's not like they could opt out. So, a lot of people try to sound like they were, heroic for not getting vaccinated. Well, you were heroic maybe, but you were also lucky that you weren't living somewhere where you had to get it. A lot of cancer patients, a lot of hospital patients had to get vaccinated. I know a lot of people who had to get vaccinated to keep their jobs, and that sucks for them. Especially some of the jobs were kind of small jobs, like minimum wage. But people had to get vaccinated to keep their minimum wage jobs just to survive, And obviously, with the passage of time, because these vaccines were forced on the population before any legitimate testing. And so even though, a bunch of paid off jackasses were saying that they're safe and effective, they weren't proven to be safe and effective, and they could not have been proven to be safe and effective within the time frame that they were developed and then deployed. So the whole thing was just bullshit. And hopefully you're aware of that by now. Let's see. So I'm just going to go through these research articles, again, connecting the COVID vaccine with mental illness. Generally, they all call it psychosis, and that just means mental illness, depending on, what type. So, after people have a type of brain insult, in this case we're talking about vaccines, depending on their particular pattern of inflammation and the brain regions that are affected, and, that person's particular genetics, that would determine the outcome of again, that inflammatory insult, which is going to have a different pattern of inflammation in different people. So I wanted to very quickly talk about the biological plausibility. How could this even happen? And some of the mechanisms, that underlie that biological plausibility. So for the last couple of years, I've written quite a bit about neuroinflammation. I've published a few articles, one of them in Nature Reviews Rheumatology, for example, another one in Proceedings of the New York Academy of Sciences. Both of those articles talked about neuroinflammation. The 2016 article was on fibromyalgia and complex regional pain syndrome, and the 2017 article was on autism. So I just want to show you a few of the mechanisms. If you have, and hopefully some of you out there do have, if you have my book, Inflammation Mastery, then you already know what I'm about to say. Because if you have this book, as dense and big as it is, then you could easily look on page 937. I'm going to show you this diagram in just a moment. I have it on my display, so to speak. I'm going to show you this diagram, which demonstrates the mechanisms of neuroinflammation. And again, this is chapter 5, page 937. So I'll show you this diagram right here in more detail in just a moment, but now you know where it's coming from. What I'm going to do right now is just draw out what I think you might want to know. And since I have a little bit of empty space here on this page, I'm going to try to draw out a few mechanisms. So the question that I'm proposing and answering here is, how can COVID-19 vaccinations, well, if you want to call it a vaccination, I mean, they're commonly called vaccination. How can that cause brain damage? How can it cause brain damage, whether that's paralysis, death, or psychosis? So, again, like I mentioned with that 2017 article, I talked specifically, and I framed that particular article within a model that we use within biology and medical sciences called biological plausibility. And so basically that's what I'm talking about here is what is the biological plausibility? How could it happen? What are the mechanisms? And of course we have, I'm sure we could come up, if we tried hard enough, we could probably come up with a list of maybe 10 different mechanisms. But in this case, I'm going to give you about 4 of those mechanisms that I think are most important for this conversation. So how could vaccines cause mental changes, whether that's depression or psychosis or paralysis or death? How could that happen? So first of all, we already know it happens. I've recently reviewed, some of the research from the American Academy of Pediatrics showing that the measles vaccine can at times directly cause permanent brain damage and death due to this, global phenomenon that we call neuroinflammation. So maybe I'll mention that here on this page. Neuroinflammation. Sorry, got ahead of myself there. Whoops, man, that just went from bad to worse. Inflammation. So neuroinflammation is a little bit of a misleading phrase if you look at it too simplistically, so to speak. It implies, inflammation of neurons, and that's not really necessarily the case. I mean, that might be the ultimate outcome, but a lot more is involved with neuroinflammation than simply inflaming nerves. So the components of neuroinflammation are many, but it at least includes what we call microglia. Those are the immune cells within the brain. But they're not the only immune cells within the brain. The brain is roughly 50% neurons and then roughly 50% other types of cells. Those other types of cells we call glia cells. A subset of glial cells are microglial cells or microglia, and those are the resident immune cells of the brain. But they're not the only immune cells of the brain. We also have mast cells within the brain, and we also have monocytes, which can infiltrate the brain during times of inflammation and cause more inflammation and more brain damage. I think I have that article lined up to show you in just a moment. But basically what happens when these resident immune cells within the brain, called microglia or microglia, when they get kind of pissed off or activated, as we say activated, that's the official term, they begin to secrete inflammatory cytokines, and that makes the whole thing worse. some of those inflammatory cytokines and other signals activate another type of cell called astrocytes. So basically, when the microglia or microglia get activated, they produce glutamate. And in normal situations, the astrocytes would uptake or kind of neutralize that glutamate. But when the astrocytes are activated in times of inflammation, they refuse to uptake glutamate. So we get more production with less recycling or reuptake of that glutamate. That leads to what we call neurotoxicity. Especially mediated through a bunch of channels which are called glutamate receptors, of which we have about maybe 10 different types of glutamate receptors. Metabotrophic with various subsets, and we have the ionotropic glutamate receptors, which can be activated independently, but which ultimately function kind of in a synchronized manner, resulting in the kind of empowered or liberated activation of a specific type of glutamate receptor called the NMDA receptor. And let me say that in a slightly different way. Maybe that'll be a little less enigmatic. But basically, your whole body has glutamate receptors. And your brain in particular has glutamate receptors. And some of those, again, are called metabotrophic receptors. And they kind of do what they do, so to speak. Then you have the ionotropic glutamate receptors. And those are important for neurotransmission. But a specific type of ionotropic glutaminergic receptor is called the NMDA receptor. And when that gets activated excessively, that can actually cause cell death. And when we're talking about brain cells, that can obviously lead to neurodegeneration, or en route to getting there, we call that neurotoxicity or neuroexcitotoxicity. So basically, those are some of the mechanisms that are in play here. So basically, when someone is exposed to a vaccine or an infection, but in this case vaccines, because vaccines are designed to create specific and non-specific inflammation. When that occurs, the microglia get activated, they produce glutamate. The microglia also activate the astrocytes. When the astrocytes are activated, they refuse to uptake glutamate. That glutamate then leads to excessive activation of the NMDA receptor, and that leads to neurotoxicity. If it's a huge dose or a huge wave, let's say, of glutamate and neurotoxicity, that can lead to seizure, permanent brain damage, and then at the far end of that spectrum would be death, of course. If it's kind of a smoldering neuroinflammatory response, then that can lead to depression, anxiety, probably contribute to conditions like autism, and in this case, I'm going to focus on psychotic responses. So now you have a clear picture of some of the mechanisms involved. What else can happen? So inflammation alone can cause vaccine-induced brain changes, whether we call that depression, anxiety, psychosis, paralysis, or death. I made a list of 4 different things just to talk about, just to get the ball rolling, so to speak. So inflammation, molecular mimicry would be another one, where certain molecules, for example, that are supposedly targeted by the vaccine would cross-react with proteins in the brain. That's what we call molecular mimicry, and that would be another way to incite brain inflammation from a vaccine. Some vaccines also cause vasculitis. That would be another way to impair brain function, of course. And with the COVID vaccines, they were designed, the mRNA technology was designed to kind of trick the body into producing antigens. Well, that can happen in the heart, that can happen in the brain, but if your brain starts producing antigens from a virus, then the natural response is that the immune system should attack those antigen-presenting cells, or APCs. So when the brain itself is tricked into becoming an APC, then the immune system is going to attack that. And that would be another way to create inflammation within the brain secondary to exposure from a vaccine. So let's look at this article. This is from Asian Journal of Psychiatry, 2023. The reason I selected this one to be the first article is because it talks about mechanisms. And they did a pretty, as we would say, I grew up in Texas. So as we would say in Texas, this is a pretty piss poor article, but it at least gives us some vocabulary. So as I said already, they list number one, pro-inflammatory response triggered by the vaccine. That's one mechanism. Vaccine-related changes in psychotropic metabolism. That's actually pretty good that they mentioned that. So that's true. So basically what they would be talking about within that context is patients who are already on psychiatric drugs. The inflammatory response induced by the vaccines would impair their cytochrome P450 detoxification, and that would lead to altered metabolism of their drugs. That's actually pretty good at this level of conversation. Activated immune state due to vaccines. That was pretty good. I don't think they mentioned, they did talk about anti-NMDA receptor encephalitis. They should have mentioned specifically molecular mimicry and immune cross-reactivity that I mentioned a second ago. Again, I'm not a big fan of this article. I'm just using it as an example and kind of a conversation piece. Oh, and this is probably why I don't like this article, just looking at it really quickly. Vaccine stress precipitating adverse reactions, which is basically trying to blame the patient and take the responsibility away from the people who are pushing these drugs. I mean, this is just stupid. So here's what they say. I just find this offensive, and that's why I don't like this article. But like I said, I included it for the sake of completeness. I downloaded all the articles I could get. So I did a search this morning. I think I found about 50 articles, and about half of those I was able to download. Due to various rumors surrounding the safety profile of the vaccine, the general population may face heightened stress following vaccine receipt. I just thought that was really stupid. So basically they're saying that you're just stressing yourself out. Even though at the same time they're saying that, this is just the stupidity that permeates medical science these days. At the same time, they're trying to blame patients for being stressed out about receiving these vaccines because of the adverse effects. They're also documenting the adverse effects. So I just think it's kind of dumb. Let's go back and look at that article. Let's go back. Oh, sorry. Having a little bit of technical problems here, but it won't take long to fix that, I hope. Let's go back and look at that. I don't even know why that happened because I already have downloaded all these articles. Let's go back and look at that image from my book, which I had already mentioned. I think it was page 200. No, sorry, 300. One more time. 937 is where you can find this diagram. And you'll notice that even back then, I did include vaccines in the conversation, and I wasn't being anti-vax. I mean, this was published back in 2016, but I was aware of data already showing that vaccines could cause brain inflammation. And again, anything can feed into microglial activation, whether it's fast food, trauma, infections, or vaccines. That leads to microglial activation. That, again, those are the immune cells of the brain. And that leads to an excess of glutamate. And that triggers a big cascade of problems. Remember, I said we have a lot of different mechanisms involved here. I'm just trying to keep this as simple and efficient as possible. But basically, the microglial activation leads to excess glutamate, and that leads to neurotoxicity, which then causes actually more glutamate release and more mitochondrial impairment. So it does become a vicious cycle here. And that's why you can see I've got the mitochondria down here. But this is the vicious cycle that people get trapped in after trauma or after certain infections or after vaccine exposure. So let's look at this article. This is actually kind of interesting. Again, I just downloaded this morning. I'll highlight some of the more important ideas here, but I'm going to try to get through all of this as quickly as I can for a variety of reasons. So let's just go through this as quickly as possible. You can see the citations typically on the pages. Vaccine-induced psychosis as an etiology to consider in the age of COVID-19. This article is actually a little more interesting for me because I actually trained at this hospital in Fort Worth, Texas when I was in medical school. So I don't know any of these authors, but I do know that hospital, and I saw some bad stuff in that hospital, I'll tell you what. So yeah, JPS, that's where I did a lot of rotations in that hospital. But anyway, moving on. So very briefly, I'm just going to try to hit the highlights here. This is a 45-year-old Asian American woman who presented to outpatient psychiatry after having psychosis for 3 months. She had new onset paranoia and auditory hallucinations that began 1 month after receiving her second Moderna vaccine. She quit her job, she stopped eating, she lost 56 pounds, and then she had a bunch of psychiatric problems, auditory hallucinations. And let's get to the end of this. So remember what I had said earlier. With any type of neuroinflammation, but in this context, brain inflammation due to vaccines, the outcome is going to vary depending on the age of the patient, their genetics, the location of the brain that's most inflamed. So if it's in the cortex, so to speak, you might see global brain damage, paralysis, things like that. If it's more on like the inner structures or the interior structures within the brain, you might see movement disorders or chronic pain or kind of more of a psychotic response as you're seeing here. Intracranial inflammatory response. And in this case, a specific type of encephalitis called anti-NMDA receptor encephalitis, which is remarkably bad. Remarkably bad because it's a paradox of kind of brain impairment and brain hyperexcitation at the same time. So believe me, you don't want that. This is interesting. Look, here they talk about low vitamin D levels. So they state, sorry, I'm trying to get the highlighter here. They state her low vitamin D levels might have contributed to the presentation, but vitamin D didn't improve her psychosis. They probably underdosed her. I hadn't seen that they had mentioned that previously. But let's see. That's pretty good of them. Her vitamin D level was low at 18, and replacement was provided after initial presentation, but they didn't say how much. So I have to assume that they underdosed her, just because they commonly do. So, again, this is just one case report, but we have plenty more to look at. Conclusion, let's just go to that, and then we'll move on to the next article. Conclusion, while most vaccinated patients obviously don't develop psychosis, rare occurrences of psychosis after the COVID vaccine are possible. Yeah, so, this is just one case report showing an association, a temporal association, without another explanation. So, a reasonable guess that this is a legit association. Let's look at another one here. In this case, so this is Schizophrenia Research 2023. And I don't really want to talk too much about this one. They're mostly emphasizing using an antipsychotic drug to treat the psychosis of kind of a neuroinflammatory response secondary to the vaccine. So this is a little bit of a tangent. So, but they do have two case reports here, it looks like. 46-year-old man, auditory hallucinations, acute relapse of psychotic symptoms 5 hours after he received the mRNA vaccine. Another one, so this is an 82-year-old man with alcohol-related dementia, but he was stabilized. In the night after receiving the Moderna vaccine, acute disorganized behaviors, severe restlessness, aggressive and agitated behaviors developed. So again, that's just a neuroinflammatory response to receiving the vaccine. Let's go on to the next one. Acute psychosis induced by mRNA-based COVID vaccine in adolescents, a case report. This is from Pediatrics and Neonatology, 2023. I'm going to post all of these articles, all the PDF articles that I have, I'm going to post them on the website when I post this video. So you're welcome to download all of these, and you can keep them, share them, do whatever you want. So this is a 15-year-old boy who presented to the emergency department with a chief complaint of agitation, involuntary limb stretching, and screaming 2 days after receiving his second dose of the COVID vaccine. So remember what I said. the clinical presentation of the neuroinflammatory response to these vaccines is going to vary based on genetics, nutrition, because some nutrients have anti-inflammatory effects. And so if a person's deficient in vitamin D, then they're going to be at more risk for developing a neuroinflammatory response secondary to the vaccine. So you'll notice here that they mentioned not only kind of psychiatric problems, but also motor problems as well. He's got agitation and screaming, but he also has involuntary limb stretching. So that would imply an inflammatory response of some of the deeper structures within the brain, not simply the cortex. He was healthy without any specific medical history before the vaccination, so obviously that's important. So this is a normal kid who got vaccinated twice, and now he's got, this neuropsychiatric presentation. Let's see what else they said very quickly. Bizarre behaviors. So this is an unfortunate kid. Bizarre behaviors, auditory hallucinations, delusions. And so let's see what happened. So he was on steroid. He was treated with steroids. Total course of steroid treatment was 3 weeks, and the patient's psychiatric status gradually improved within 2 months. His thinking capacity and emotional expression also showed significant improvement. So that's great, but you'll notice that they said he improved. They didn't say he returned to normal. Our case report highlights the need for awareness regarding possible neuropsychiatric complications with mRNA COVID-19 vaccine in children. Psychosis associated with COVID-19 mRNA vaccine can be treated with steroids when traditional antipsychotic medicines are found ineffective. However, long-term follow-up of the patient's cognitive functions and behavior is necessary. So this kid is probably going to be at higher risk. Well, he is. There's no probably involved. He is going to be at higher risk in the future for psychosis, dementia, and probably epilepsy. So the chances of this kid being normal are highly unlikely. Let's look at another one here. This is from 2022, the same journal that we looked at previously. Primary Care Companion, CNS Disorders, 2022. Psychosis associated with COVID-19 vaccine. Let's just see what they said here. Case reports of various psychiatric symptoms in psychiatric patients, but also those with no previous history of psychiatric illness following COVID-19 infection. So a couple of cases of psychosis have been reported after the infection, not simply after vaccination. And that's not too surprising. Anytime the body's having a generalized inflammatory response, some people are going to have some type of psychiatric response to that, whether it's depression, anxiety, or overt psychosis. So not too surprising. Let's see. 20-year-old single woman, final year of technical college, no past significant history in herself or her family, brought to the emergency department after having a single seizure-like episode. So remember what I said earlier, the ultimate or the final common pathway of a lot of these inflammatory responses is a glutamate release, and too much glutamate is going to cause seizures, and that's what happened with her. She also had anxiety, sleep disturbance, behavioral changes. That started a few days after receiving the second dose of the COVID-19 vaccine. So it's no surprise, No surprise whatsoever. And so this is another unfortunate case. Let's go on and look at some more. Here's one. Acute psychosis after immunization with whole virion inactivated COVID-19 vaccine. A case report from central India. So very quickly, a 17-year-old adolescent girl presented with acute illness, 1 month duration, restlessness, fearful, suspicious, talking to herself, poor self-care, disinhibited behavior, decreased food intake, and decreased sleep. So she's somewhere between, kind of like schizophrenia and hypomania. Uncooperative, restless, fearful, with hallucinations. Let's see what they did with her. So you would expect them to use antipsychotic drugs and steroids. Hallucinations. Oops, sorry about that. Let's see if I can highlight a little better. So yeah, just typical stuff. So anyway, just another case. And obviously, if this was one case report in the history of medicine, I'm going to say two things here. Then, we could take it or leave it. But when you see a lot of case reports from different countries, all kind of showing the same pattern of normal, healthy people who get vaccinated and then become psychotic, then you have to, that's a pattern, and we have to start taking that seriously. The other thing that I want to mention, and this is very important, anytime you look at research discussing the adverse effects of vaccines, especially these case reports, you have to understand like the professional context in which that happens. And believe me, and anybody would know this. I mean, you can kind of figure this out even if you've never worked in a hospital. But people who work in hospitals are typically overworked, underpaid, stressed out, and they're supposed to just shut up and do their job, basically. So, the idea that you're going to get, in this case, almost 10 different researchers or doctors, the idea that you're going to get 10 doctors to work together when they're already overworked and underpaid, and when they're supposed to shut up and not say anything bad about the vaccines, and then they're going to actually do the background work and write-up and submission and the whole publication process. They're doing that on their free time. They're not getting paid to do this in most cases. In fact, they're being actively discouraged from saying anything bad about the vaccine. So that's another reason why these case reports are so rare. Not necessarily because the event itself is rare, but because, who wants to do this on their spare time? Nobody. And then, just because they publish something in Science doesn't mean they're going to be appreciated by their bosses and their colleagues. They have to do the work on their spare time. It's a big hassle. And what are they going to get out of it? Nothing. They're actually going to, be kind of blacklisted because they've actually done this publication. So, if medicine were truly honest and truly scientific, then these people would be praised and they would get a raise maybe or a bonus or a couple days of vacation for doing this extra work. Hell no. That's not how medicine works. A big part of the culture of medicine is shut up and do your work. They call that being professional. You're not supposed to have an opinion outside of what you're told, and you're just supposed to do your job and go home. It doesn't matter if you saw people get killed by the medical system. You're supposed to shut up and go home after you've finished your shift. So this is, again, Schizophrenia Research, 2022, case report. First episode, Psychosis. So again, another normal, healthy person. 18-year-old female student without any psychiatric or medical history. Brought to the emergency department by family members because of irrelevant talk and bizarre behavior. No past history, no substance abuse. Received her first dose of the vaccine, and within 2 to 3 hours, she developed high-grade fever, chills, multiple episodes of loose stools. Wow, that's very interesting. So she had a generalized systemic inflammatory response that involved her brain and therefore her gastrointestinal tract. That's awesome. That's the same pattern that you see in autism. But she's too old to develop autism, straight away. Dizziness, she fell down. Local hospital, intravenous fluids. Yep, and then she went downhill from there. Visual hallucinations, seeing God and demons. So, yeah, well, that's acute psychosis. Vaccine-associated psychosis. The COVID shield vaccine. That should be illegal to call it COVID shield when it doesn't even protect against reception or transmission. Continued symptoms, emergence of catatonia, so she's not talking, mutism, staring, rigidity, negativism. Wow, so she's full-blown schizophrenia. She's full-blown schizophrenia, basically, after getting the vaccine. Wow, that's amazing. Catatonic features in the index case could be due to disruption of associative functions, especially the frontal lobes and parietal cortex with motor areas, also in the cortex, contributing to the akinetic form of catatonia. Yeah, so she's basically trapped in her body. She's not moving, she's not talking. Wow. Well, that's sad. So Frontiers in Psychiatry, this was published in 2024. New onset psychosis following COVID vaccination. Systematic review. This will be nice and easy because I'll just read the abstract. A total of 21 articles, which is close to what I found this morning, actually. 21 or 22 articles. Described 24 cases of new onset psychotic symptoms following COVID vaccine. Half of them were female, etc. Let's see what else they say. Yeah, so, to get published, a lot of times they have to say stupid stuff, even if it's contradicting what they actually are writing about. So here they say vaccination is generally safe. And I don't even know if that's true. But they have to say stuff like that. They have to say it's safe. They have to say the adverse effects are rare. Even though, internationally we have no reporting system on adverse effects from vaccines. So basically, in a sense, you've only got two types of safety monitoring for vaccines. It's either pre-approval or pre-authorization or post-approval. Well, pre-approval, the pre-approval data is always done by the drug companies. So of course they're going to say it works and it's great and we didn't see any negative effects. And the post-approval surveillance doesn't exist except for a few case reports and people doing this on their free time. And I guess that includes me right now. So you have to understand what a complete pile of bullshit is the idea of vaccines being safe and effective when there is no legitimate system for determining that they're safe and effective before authorization, because that's all done by the drug companies. And after the drugs are authorized, no one's looking at the risk. Again, you get a few people, writing up articles on their free time, but you're talking about 1 in 1,000, 1 in 10,000 cases at that point. So it's going to always be underreported. But data, I'm going to underline this. Data suggests a potential link between young age mRNA and viral vector vaccines with new onset psychosis within 7 days post-vaccination. So yeah, then they just blabber. So let's look at another one here. Psychiatry Research, 2021. Can new onset psychosis occur after mRNA-based COVID vaccine administration? A case report. So that's another thing that, medical writers have to do sometimes is they have to phrase their assertion in the form of a question because they don't want to be seen as being anti-vax. The journal, these journals get a lot of advertising money from drug companies. They don't want to be perceived as being anti-vax, so-called anti-vax. So they have to be very careful with the way that they say this. So again, you can look at multiple layers of filtration before an article like this even gets published. So looks like they talk about most of the case right here. So let's just focus in here. 31-year-old single Hispanic male without past medical history or psychiatric history, brought to the emergency room by police because of erratic and bizarre behavior. Anxious, guarded, grandiose. He reported becoming clairvoyant, being able to talk with dead people, and hearing people drumming outside his house. Sounds like a typical weekend in Austin, Texas, but maybe not. Constant voice of a coworker who he believed to be something. I've never seen that word. Paramour, so that's kind of an affectionate relationship with one of his coworkers that apparently didn't exist. All these symptoms began 1 month ago after receiving the first dose of the COVID vaccine, and then everything got worse after the second dose. So yeah, he probably has vaccine triggered and then vaccine exacerbated psychosis secondary to neuroinflammation. So anyway, without any past medical or psychiatric history. So yeah, he got brain inflamed from the vaccine, sounds like. First episode psychosis. This is kind of a European journal. I had a hard time getting this article, but I did eventually get it. September 2022. First episode psychosis following COVID vaccination case report. Another nice structured or semi-structured abstract. After the second injection of the COVID mRNA-based vaccine, immediately developed anxiety, nonspecific fear, and insomnia as the prodromal phase of psychosis. Very well stated. At the second week, patient manifested delusions of persecution, delusions of influence, thought insertion, delusional behavior, culminating in a suicide attempt. Very common as well. So neuroinflammation is definitely a risk factor, not only for depression and anxiety, but also suicide attempt. So they gave him antipsychotic drugs, tincture of time, probably some steroids. This case indicates a strong causal relationship between mRNA-based COVID-19 vaccination and the onset of psychosis. So obviously they have to follow him up for development of schizophrenia and understand that the COVID-19 vaccine could possibly play a trigger role in development of psychosis. Yep. That's what I said earlier. Let's look at another article here. May 2024, autoimmune encephalitis associated with post-vaccination and infection of SARS-CoV-2 in a patient with narcolepsy. Wow. So a lot of cases of narcolepsy are actually triggered by vaccination. So maybe this patient already had vaccine-induced narcolepsy and then developed vaccine-induced psychosis secondary to the COVID vaccine. Maybe that's what they're going to talk about here. Let's just take a look. I could probably take a break right now and go get something to eat because I haven't eaten any solid food this morning, even though now it's 4 p.m. So I think I will do that. That would give me a chance to divide this video, the editing and processing of this video, in two different chunks, so to speak. And that's probably a good idea because my recorder, which I'm using and pointing to right now, tends to get full after about an hour's worth of time, and right now we're at 47 minutes. So maybe I'll divide this video into two sections, and that may help me get it on the website faster. So I'm going to pause the video right now. I'm going to go get something to eat, and then I'll come back and finish up the remainder of these articles. Thank you very much, and I'll get back to you as soon as I can.